Neonatal abstinence scoring is a list of symptoms used to identify if an infant is born addicted to opioids or if they show signs of opioid exposure. Each symptom has a score based on severity, and at the end of the testing, the score is added up and treatment is based off of that number. Once an infant is born, the first score should be taken 2 hours after birth to attain a baseline. Once this is obtained, testing should occur every 3 to 4 hours for 4 days. Also, this scoring table is based on full-term babies, so preterm babies may need modification. When looking at the chart, the first thing you will look at is if the baby has a high-pitched cry and is unable to decrease the crying within 15 seconds of consoling methods. If the crying is up to 5 minutes, they get a score of 2, and if the crying is greater than 5 minutes, they get a score of 3. The next thing you will observe is their sleep. If the baby sleeps less than 2 hours at a time, they get a score of 1. If they sleep less than 1 hour, they get a score of 2, and if they do not sleep between feeds at all, they get a score of 3. Next, you test the moral reflex. If the baby is jittery with their hands during or at the end of the reflex, they get a score of 2. If the baby is jittery with their hands and arms right after you initiate the reflex, they get a score of 3. After this, look at if the baby has tremors. A score of 1 will be given if the baby has tremors while being handled. A score of 2 if there are tremors in the arms and legs while in a sleep-wake state, and a score of 3 if tremors are present in the hands and feet while not being handled. Also, a score of 4 when there are tremors in the arms and legs when not being handled. Next, look at if a muscle can resist movement. The baby will get a score of 2 if there is no head lag noted with total body rigidity seen. Next, you will rub a baby's extremity against a flat surface and see if an abrasion occurs. The baby will get a score of 1 if an abrasion is present anywhere on the body. After this, see if the baby has any involuntary muscle jerks. They will get a score of 3 if muscle jerking is present. After this, observe if the baby has generalized seizures or the baby has tonic extension of all the limbs. They receive a score of 5 if this is present. Next, take the baby's temperature. If the temperature is between 99 and 100.8, they get a score of 1. If the temperature is greater than 101, they receive a score of 2. After temperature, check if the baby is sweating. They will get a score of 1 if their forehead, upper lip, or back of the neck is damp. Observe awning next. A baby gets a score of 1 if they yawn more than 3 times during scoring. Next, if the baby's chest, trunk, arms, or legs have a marbled appearance, they get a score of 1. After this, check if the baby has a runny or stuffy nose. They get a 1 if that is present. Next, look for sneezing, and if the baby sneezes more than 3 times, give them a score of 1. After this, see if there is nasal flaring present, and the baby gets a score of 2 if repeated flaring is present during your assessment. Next, count the baby's respiratory rate for a full minute. Give a 1 if respirations are greater than 60 without retractions, and give a 2 if respirations are greater than 60 with retractions. After counting respirations, observe if the infant has excessive sucking or rooting. If the baby seems hyperactive in this more than a hungry normal infant, give a score of 1. Next, if the infant displays poor feeding, give the baby a score of 2. Along with that, if an infant regurgitates his feeding more than 2 times during the feeding, give them a score of 2. Also, if the baby projectile vomits during or immediately after a feeding, give a score of 3. And lastly, if the infant has loose stools, give a score of 2, and if the infant has watery stools, give a score of 3. So that is all the steps in the scoring process. So once you finish all of that, add up your score, and then you can determine the next steps. If an infant scores between 9 and 14 3 times in a row, or if they score greater than 14, pharmacological treatment is recommended. The recommended treatment is giving morphine every 3 hours. You will do 0.05 milligrams per kilogram. You can start a weaning dose once scores start to decrease, and treatment will be continued until the infant score is an 8 or below.